Hello and welcome to Michael and Ivanka's Grand Podcast, a weekly podcast where we figure out what we think about everything in the whole universe. My name is Michael Forrest.
And I'm Ivanka Majic.
And both of us together are Michael and Ivanka's Grand Podcast. And this week we're going to talk about, in episode 188 of this crazy podcast, we're going to talk about public health, aka what is wrong with these anti-vax people.
Yeah, have a word.
Talking points led by Ivanka.
Yes, talking points are, I read a thing on Facebook, Billy Bragg talked about some people he chatted to on outside his gig who were talking about apartheid and their freedom and blah. And then my knitting group, one of the administrators of the main Facebook thing, turns out she's a freedom fighter as well, which is a bit freaky. And also we're planning a trip to the United Kingdom for Christmas times, and should one travel in a pandemic?
Should one travel ever again?
And so there's a whole stuff of self versus society that I think public health captures perfectly.
Yeah, and sort of greater good and generally it's not being selfish, that kind of thing. Yeah. Let's get ready to you think I'm supposed to feel bad because I haven't had a vaccine? Yes, you are.
Yes, you are.
Okay.
Yeah.
How's it going, Ivanka Majic? What was the best thing that happened to you this week in our newly concise half-hour podcast?
So, last night, I was sitting on the sofa, talking to my brother, going, you need to help me talk myself out of this, cocoon I've created for myself, because we really do need to come back to England to visit people, and chatting away, and then passports came up, and I was like, my daughter's 5. Her passport must have expired. Oh my gosh, I haven't done anything. I haven't been anywhere for 2 years. Oh my goodness, what am I going to do? Right. Google, find, how do we get things? This morning, took a passport photo of her, everything set up by 7 o'clock this morning. Come upstairs to find her old passport. Clever me. I renewed it. Early. That was such a relief. I'd even forgotten how clever I am.
Sometimes you just got to trust your former self, haven't you? And you're like, I've misplaced my keys like an idiot. No, I put them in a special place, exactly where they're supposed to be. So well done.
I was very happy.
Great relief.
It sounds like, basically, looking at the dates, I reckon when we came back to Brighton for that 2-month bit before the whole COVID thing, I'd applied literally on the day we got to Brighton to allow 2 months for it to arrive. So I was all over this. So yes, well that's done. The nicest thing. I was very pleased with myself.
Splendid. Is that hasn't she got 2 passports now?
She has.
She just got the one. But you just
But I was a bit like, why come? Yeah, we don't have to become arriving in England a foreigner. That could probably cause all sorts of problems. Yeah. But yeah.
All right.
So there you go.
Yeah, best thing that happened to me this week was, I'm just going to say, I had a really good chat with someone on yesterday who is a sort of video training coach type person, and really because I've been sort of struggling. I am only working. All I do is work. All I do is think about this business and how low my numbers are all day, because that's my whole existence, day and night. And I'm just hoping at some point some money comes in so I can actually relax when I'm relaxing. But had a really good conversation that made me have some hope that I can get out of this cycle of working on software the whole time instead of talking to people, interacting with people, getting them to pay me lumps of money to help them in a way that I can really easily help them. So I'm sort of feeling quite, and also just realizing that the sort of the motivations people have, even if they're from a completely different sort of walk of life, we all want this, just realizing that we all want this self-assurance to be who we are, and that can be given by like recording a podcast, like as we have proven to ourselves. Just actually, like, so yeah, I had a happiness app for tracking happiness, but actually maybe this app that I've made that's a camera app that helps people actually like show who they are on the internet and maybe edit it and then maybe live stream it is actually like making a lot more people happy, actually being a part of their happiness rather than being something sort of external to it that they're kind of measuring it with. So that was that was motivating, kept me up to last night. I'm quite scared, but even a conversation we just had, I'm like, I'm just going to see if people would pay 500 quid to talk to me for like 20 minutes and, and then, see how that goes. Yeah. So yeah, that's where I am. And the breaks this week, because I appear not to have left the house, I will warn you, are from Legend of Zelda Breath of the Wild. Are you ready? I don't know how well that translates, but I tried to shield surf and it immediately broke, and then I rolled down a very high hill. Hilarious. Let's take a hard right turn now. Let's take a hard right turn from that into the arena of public health.
Public health, yes.
I'm not trying to virtue signal, but
right,
like, how hard is it to put on a mask? And how hard is it to go and have an injection that takes 10 minutes, 20 minutes out of your day and doesn't even hurt? You don't even feel it. Maybe you vomit later if you're unlucky. How hard is it really to do the right thing? How hard really is it?
I think so on Sunday, I had a delightful Stitch and Bitch gathering in the sunshine outside on the seafront here. The cafe was idyllic. It was
Check you out with your making this thing come into existence and then it keeps happening.
It was idyllic. It was like, there's a portable cafe, the guy was there with his bicycle coffees, and there was a person playing the mandolin, and it was dreamy, Adriatic, beautiful, amazing. Anyway, so there we all are. And I start chatting to somebody about the fact that it's very easy here in Croatia land to start getting really paranoid about vaccines because nobody's getting. There's a really low vaccination rate, and there's a lot of this. And I think it has something to do with the politics of being a former communist country, for sure.
Right.
Like, I think I just did a quick look on the BBC website about the stats, and the lowest recovery rates are in Bulgaria, Bosnia and Herzegovina, Macedonia, all these countries that are like Balkan, don't trust their government type people.
Right.
And so we were chatting about how, there's a point at which you're like, am I the idiot that wants to get vaccinated? Like, what is the matter with it? So many people are talking about it. It does feel a bit like that sometimes. And then we spoke about the fact that really nobody wants a pandemic. It is terrifying.
Yeah.
And we are all living through a trauma. And some people's reaction to the trauma is that fear-anger reaction.
Yeah.
And I think a lot of this freedom fighty, anti-vaxxy stuff that people have got hooked into is to do with their fears. Like, it's a rejection of what's going on. Like, I want to fight this pandemic, and I'm going to fight it by denying it and rejecting its existence rather than going, what can I do about it? That's my discuss.
Like, it seems like so much more effort to do that than just to do the thing that if everyone just does it. What I find weird is we were waiting so long for this vaccine. Like, it felt like eternity. And the vaccine finally comes, and then what's people's reaction? Oh, I'm gonna.
It's too fast.
Like, why did it take so long? Because it came too quickly, which it didn't seem to be coming quickly. But then also it's like, so what? So what do we do then?
Yeah.
Because the vaccine was the thing that we needed, that we were waiting for, and now what? You're going to reject that. So what's the plan? Is there some other secret science that is going to work? Are you not going to reject it if it comes? Like, what do we have to do to convince you that this is?
what I think is also fascinating about this, so to talk of you,
No.
they're not just rejecting the vaccine. They're the same people that will reject getting tested regularly and will reject wearing masks. So it's like, what are you
What do you want to do? What is your answer to this?
What is your solution? Your solution is to deny existence. What another little news bulletin from the Croatian island of Brač is a clearly well-loved local doctor has died of COVID. I have it on very good authority, because I've never seen him in person, that he was an anti-vaxxer and that he wasn't vaccinated.
A doctor.
And that a lady went to see him in the summer who lives in Zagreb, and she had her mask on and he didn't have her mask on, and he kind of went, COVID, schmovid. And now he's dead.
Okay.
And I'm finding it very hard to feel sorry for him.
Is it like not enough people have died that everyone knows someone that died from COVID? It's like,
maybe.
Is it like if your father had died of COVID, would then... Is it just that you don't know anyone directly that's died, so you think it's not real, that you think it's not worth doing 3 things, maybe taking a risk? Oh, you're rolling the dice on this vaccine. Yes, maybe.
Yeah, maybe
we will learn things in future, but clearly it's having an effect. And also, everyone in science is telling you, apart from your doctor person apparently, is telling you like oh shit, I forgot my point.
This is the way forward.
Everyone is telling you that the more people that don't get vaccinated, the more there is going to be variants and mutations, and the longer this thing's going to drag out. So, like, I don't understand, because it's such a small thing to do, and why blow it? I mean, but again, like, who am I talking to? Obviously, to me, I don't understand because I don't know. But what would these people say that?
But I find it really like so on Sunday, when I was chatting to this person who is vaccinated for sure, but she's now got another new friend who's also banging on about it. She's like, I'm just having a moment. I was like, I'm with you, I'm here for you. We will make sure we stay sane together in this insanity. But it's like, I was like, my daughter exists thanks to a lot of very fancy science. How can I now reject that same science? That when it comes to protecting her and when it comes to protecting society. And then this woman I was talking to, she said, oh yeah, my daughter was 10 weeks premature, and if it weren't for some very out there crazy science, she wouldn't have survived. And it's like the kind of, and so I said, as soon as I'm able to, I'm going to vaccinate my daughter. And she was like, oh, I hadn't really thought about it. Let me know as soon if you hear anything about Croatia vaccinating, let me know so that we can get on it. But it's just that sort of this rejection of science that people rely on for all manner of other things, and suddenly like it's not good enough.
And would they say it? Would they characterize it as a generalized rejection of science, or that I feel like if you talk to them, they'd say, oh no, it's just this bit of the science that I don't like, it's because of this and that and the other. Like, is it like you can't pick and choose unless you're gonna, like, no one's reading these like I feel like if you're gonna have an opinion that goes against what the most prominent scientists are telling you is the consensus, then it's incumbent on you to like look at the peer-reviewed papers and look at all the data properly and look through it. And the level I'm seeing of this is, because they've encroached on my neighbourhood, some anti-vaxxers. They literally on the corner, like there's a church in front of the big Sainsbury's, and they were protesting. I came past on my one of them had like 1,300 vaccine deaths and counting placard, and another one was like, don't vaccinate our kids. I'm like, both of them, I'm like, okay. But I found myself thinking a lot about that 1,003 whatever, and it's like, so you've read that 1,000 people have still died despite having the vaccine, but it sounds to me like you're comparing that to no one ever dying of anything. which is not Are you comparing that number? What would the number be? What is the number of unvaccinated people? What is the rate of unvaccinated people dying versus the rate of vaccinated people? That's the number. But you've just found this number, and I feel like you've got, oh, that's a lot. Some people have died that had the vaccine, therefore the vaccine doesn't work. It's like there's literally a percentage on the vaccine that says, look, it's this percentage effective. And I just feel like these people are that, what are they? I feel like, could I sit down with that person and explain? Like, would they understand if I said, look, okay, yeah, that's a scary number, but you can't compare it to nobody ever dies.
No,
because obviously people are dying of stuff, and obviously some people have, there's different situations that people are in, and different people are more vulnerable, and maybe there's something about the vaccine that kind of doesn't work with some people.
Yes,
but if you're looking at the numbers, you can't compare it to zero. You've got to compare it to what it is when you're not doing it, and we saw what that was. It was hundreds of thousands of people. So your friend has to be holding a 500,000 unvaccinated deaths, and then we'll have a clearer picture of what's going on here. I don't know, but how do you have the conversation without getting angry? Find out after the break. That was me riding around on a bear. That's again a sharp tone shift. Is it possible to have a conversation with these people without just screaming at them? Because I don't know how to. I literally just went past someone, the one with the sign, and gave her a hard eye contact middle finger as I came past on my bike. I was like, right, I want her to remember my face, the level of contempt, the level of disappointment in my eyes. I want that to haunt you forever for doing this. So that's not a solution, is it?
No, but it's tempting. It's so hard. I'm building up to talking to somebody who's truly anti by practicing with people who are not anti. But like people who are a little bit quiet. So for example, I'm bringing up I throw into casual conversations, this is my litmus paper, throwing into casual conversation, I can't wait till I can vaccinate my daughter so I can relax.
Right.
And then people go, so you're going to vaccinate? And then they go, we're all vaccinated, but I was a bit hesitant to vaccinate child X and then you start having a conversation about it. But it's kind of a nice, gentle way in, I think, because I'm presenting it as wanting to protect my child, which nobody can ever, you don't argue with people who are trying to protect their child. But equally, I understand that people who are anti-vaccinating their children are setting it up as protecting their child. And this is where things get tricky, I think, and why I wanted to phrase this as public health. Because I think public health, which includes vaccines, not spitting on the streets, not wiping snot on bus chairs, this is like if you take something to its extreme, I don't think that is outside the realms of personal choice. That is public health, and we all, the public, we people agree that there are certain things we do to help all of us survive.
There's even if that takes a bit of a patriarchy to achieve, look, everybody, I'm going to tell you that this is causing problems and you just got to do it, and everyone's just got to do it, and I know you can't see the point, but you just got to do it, and there needs to be an authority. People listen to those voices of authority. I think generally. I think most people will listen to Boris Johnson telling them what to do in this country. I think because they'll be the government's saying that we've got to do it. I think most people are quite obedient when it comes to these things. It's like, okay, well, 5 a day. Well, maybe they're not so good at that, but okay, don't eat so much fat. It was transformed by that health advice going out, and that people's behavior is affected by that stuff. So then you get leaders trying to sort of hedge their bets and trying to sort of play, that populist type of approach to kind of telling people what the right thing to do is, to try and say, yeah, but there are freedom-loving people and they don't like following rules. It's like, doesn't mean you don't give them the rules. That doesn't mean you don't give them these things that you shouldn't do, because otherwise they're just not going to know. They're not going to do it at all. I'm just yelling and ranting. I feel like I'm off topic.
I think one of the thing in that Billy Bragg comment was that it's like he part of his sentences, I'm paraphrasing, but it was like, I support people's personal choice not to get vaccinated. Yeah. As a side note, I do not support that. But he said, but then they have to accept that there are consequences that they have to live with. And so they, including not coming to gigs in a enclosed public space, or
wearing a mask at all times.
That's what you've decided. That's what you've decided to do. Okay. Yeah. I don't, but because it's, and I was a friend of mine has put on her Facebook status, a Croatian friend who I see so rarely, and one of the things that's keeping our friendship alive is her very vocal pro-vaccine approach, because she's like put up a thing to say 3rd dose, I'll have 33 if I have to. She's like, like actively pro-vaccine. And then she put a little quote from somebody who was interviewed on the streets of Split, who's like, it's not fair, the vaccinated people are going around, they can go wherever they want, and those of us who aren't vaccinated have to get tested.
you don't want a vaccine, you don't want to wear a mask. It's like,
and you don't want to get tested.
Like, what are you going to do? Like, how are we going to, what's your answer? I don't know.
Sit at home.
But I did promise people the answers to how to talk to these people, because what I've pulled up is the 1-page summary of How to Make Friends and Influence People by Dale Carnegie. And I think it's very telling. In these times, it's very interesting. It's a book that I just finished, and I'm trying to remember to do it. So, fundamental techniques in handling people. Let's just see how this all plays in. Right. 1, don't criticize. 2, give honest and sincere appreciation and arouse in the other person an eager want. And the criticize thing is if you criticize someone, they just double down on that belief. Generally, it just sets off a defense mechanism. So his first rule is do not criticize people. It will get you nowhere. 6 ways to make people like you. Become generally interested in other people. Smile, remember a person's name, be a good listener, encourage others to talk about themselves, talk in terms of the other person's interests, and make the other person feel important, and do it sincerely.
I've had this. I actually, in my user research book, one of my first things, advice for running a user research interview, it's don't pretend to be interested in what I'm going to tell you. Actually, be interested in what this person is going to tell you. Otherwise, they're not going to tell you. Go on.
well. I think a lot of these people don't feel important, and the only way they can feel important is to go out and parade around with a sign. And it's weird, because it's, in a way, it's a sign of progress that people see that protest is a thing, but it's just like the internet was this new world of finding groups of people that we wouldn't ever have met before, and finding these communities and finding a sense of belonging that never before existed, and then ended up getting hijacked by Nazis. It's sort of like a similar thing. It's like all the meaningful protests that are kind of pushing towards hopefully genuine social progression and change and improvements, then we could do that too for nonsense, because everyone can sign a petition on change.org. It's it's good that they're seeing that there's some sort of sense to social movements and sort of bringing people together like this. It's just a shame that they're wrong. I mean,
it's how do you, I think that's all very well, she said, with her voice going slightly high, but it's all very well, but I had a chat with the lady in the pharmacy here, the pharmacist, and she was the one that told me about this GP being ill, And she's like, I don't understand what has happened to this society. We've gone back. She said, next, everyone's going to be telling us that the earth is flat.
Next.
It's like, what does that make? They already are. And how do you then argue with somebody who's telling you that the earth is flat? It's like, no, smack.
Yes.
Like, some things are wrong.
Yeah. Well, I want to keep this podcast shortish because the next one is win people to your way of thinking, and I think it's going to be very interesting in this. But I want to keep this concise. So let's do break number 3. More Zelda.
Let's do it.
Right, that was me fighting a Hinox and a Guardian at the same time. Right, win people to your win people to your way of thinking. Right, rule 1:
do that? Yeah,
the only way to get the best of an argument is to avoid it. 2, and this is going to be hard. 2, show respect for the other person's opinions and never say you're wrong. Right, if you're wrong, admit it quickly and emphatically. Begin in a friendly way. And then there's this get the other person saying yes immediately. Let the other person do a great deal of the talking. Let the other person feel that the idea is his or hers, is their idea. Try honestly to see things from the other person's point of view. Be sympathetic with the other person's ideas and desires. Appeal to nobler motives. Dramatize your ideas. Throw down a challenge. This is his 12 ways to win people to your way of thinking. It essentially involves if you try and tell people you need to coax them round and understand them and connect with them first, don't you?
I think that's partly why I can't wait to vaccinate my child so I can chill statement works so well, because there is a bit of drama in it. It's like, I'm so worried. It's going to be such a relief when I don't have to worry. And you can't, it's hard to, and then people might say, so one of the things that comes back, so I'm a bit hesitant, I've heard such and such. Then I go, this is my story, literally. And I go, well, I've got a friend of mine who's, she makes a lot of science documentaries and she spends a lot of time reading scientific papers. And I always ask her things. Mm-hmm. And I sent her this text message that said, I'm thinking of vaccine. What do you think? And they're like, okay, so I've presented a reliable source that's not me, but a trusted source. Yeah. And then I mentioned people like Katie, but not my name, Katie. I've worked with somebody who's worked in epidemic preparedness, and science has been preparing for this pandemic for 20 years. So all this, the vaccine came really fast. It didn't. It's taken 20 years. So I do that kind of so this is my friend and this is who it is. It's like that woman that was in my house that said she wasn't vaccinated, the one where I really had to control my temper when I was talking to her. And she was like, this person died. Like that. I was like, no, my cousin died. And she was like, oh, it's like there's a, but I didn't, the yes, I got her to do only by talking about fear and uncertainty and agreeing that this was scary and uncertain, but that on the grand scheme of things I was happy. Maybe I feel better about this than I thought. Let's see if I can
can you win someone over?
Can I do something?
I don't know how I'm going to do it because I just get so angry in these situations. But I suppose is there a way to say okay, so the vaccine did come quickly. How much what would it take for you to be happy that it has been adequately tested? How long do you want to wait to know whether it's okay? I suppose the danger is people go, 5 years, and you go, but it's and then you sort of have to say, well, don't you feel this has been such a globally significant event, and it has had such huge economic effects that there's huge motivation to sort of make this thing good and quickly, right, in a way that has never, like, unprecedented really in human history, do you think maybe they might have thought of that?
Yeah.
I don't know. I've not. As soon as I try
don't
and
think what I was going to say that maybe what do you suggest I do to protect my child is like, so what do you
can
do?
I do?
What can I do
What are you
if
doing?
I can't
Yeah.
get vaccinated? What are you doing? Because I think it's like this. It's this. I've just had there is that I think we're still, as with many topics, we've discussed this over and over again. It's that it's a theme in the whole podcast. It's like people like us that think what we do are not out there arguing with people.
Well, this is.
I don't think we are.
Well, and it's one of the I did watch this very good. I sort of hesitate to recommend because he's like so young, but like this guy CJ the X, I watched this long. It was his kind of take on Bo Burnham's Inside. So, and he was his sort of central. One of his central things was we need to have long form conversations because trading tweets and trading placard slogans is what's got us into this mess. And as soon as you sit down and have a long form conversation with someone, then you have a very different interaction. But people want to get angry on Twitter and it goes backwards and forwards and it gets us nowhere. And it just like polarizes more and more and more because you're not having a serious discussion and you are treating the other person as a sort of other at that point.
We should have a conversation with David about how he got on when he was booking, before the election, he was booking to have chats with people. You're totally right. Oh, so I think that's a really good point. So the admin on this knitting group that I have created a fork for that goes off onto my island. I was like, oh, cool, she's come up with this thing. We've got a thing in common, chatty. And then I realised that in her spare time, she was walking around protesting for freedom. And since then, apart from very basic administrative conversations, I don't want to talk to her because I know that it's not going to work in Messenger. Like I've been like thinking about composing a really long thing to explain to her, but actually what I should probably do is invite her for a conversation. Just say, look, I need to talk to you about something, and go, because I've noticed this, and I think that would be the way, because I'm essentially ghosting her in it because I don't want to.
It's hard, and it's like because you're gonna get. I think it's a different sort of adrenaline that you get from I'm gonna meet someone in person. I mean, it's the same adrenaline, but a tweet is sort of like this angry thing or the middle finger. Like it hurts you more than it hurts. You're thinking about it. It's making you angry. Hopefully, it makes the other person angry too if you did well at the tweet. Like But it's a sort of different. It's a kind of catharsis. I've thrown something over the wall and given them the middle finger. But that the prospect of having to talk to someone that you have like fundamental disagreements with is not something anyone really relishes. I don't think. It's like, oh God, I've got to talk to this person. What are they going to say? Like it's it's I find it very scary, and I'm if I don't have to, then I'm probably not going to do it.
But I think that's one of the reasons that knitting thing is doing a little bit what I thought it would, which is outside in the sunshine. You have to have you have a conversation. Let's have a chat about that GP that just died that wasn't vaccinated. What about that for a topic? Well. What about what are we going to do about vaccinating our children? And it's relaxed. You're doing something. You're also not confronting each other. So that's a nice thing about gathering to do something else. Everyone's looking at their knitting. And that, they're like, you're doing a thing and then you're having a conversation and it's less like fighty. But I need to invite this woman over to the island probably and just sit down with her and go, listen, love. Let me tell that's not going to work though, is it? But
plus you won't be vaccinated, so you won't be able to.
I don't want to go anywhere near her.
All right, let's end the episode there on that slightly depressing note. Thanks for listening. If you like the podcast, go to grandpodcast.com and you can find where can people find you on the internet, Ivanka?
People can find me at Ivanka on Twitter.
You can find me at squares.tv or at Michael Forrest. If you want to hear the podcast early by like 3 days and it be a video, you can support us on Patreon, grandpodcast.com. There's a link from there. I literally will immediately now upload the video, and that will be available to all Patreon supporters immediately. If you can't
immediately,
wait. If you can't wait to hear us talk about this, then there it is. Do you get something? I think you get something. You get access to the Slack and things as well. So that's it. I think we're getting closer to our new podcast.
Yep.
Niche idea.
Now that we've practiced on you for
now that we've practiced talking to you for ages, I think it's actually like more and more I'm seeing it as something that actually a lot of the people that I didn't think would be interested in like a change of tack will actually really benefit from. Like I think Sharon, Bruce, I think you'll all like actually find this really useful. This tack that we're looking at right now. So there we go. We'll see you next week. Take care now. Bye. 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 Bye.